Good afternoon, everyone. My name is Graham Wilson. I'm the director of the Initiative on Cities at Boston University, and I'm here to welcome you to the seminar, COVID-19 and Cities, Pollution and the Environment. As you probably have already heard, there are two sides, at least, to the relationship between pollution and the environment on the one hand and COVID on the other. The most obvious and sad one is that COVID is reinforced by pollution problems. People who are vulnerable, living in bad environmental circumstances, are more vulnerable to getting COVID, and even more unfortunately, more vulnerable to dying from it than people who are in better environmental circumstances. It seems perverse then to talk about what you might almost call the good side, that the shutdown has led to a temporary decline in pollution. We've all seen those wonderful photographs of cities without the pollution that we have got ourselves used to, cities with clear skies. And one of the question marks going forward is, are we going to keep that? Are we going to build on that? We've seen announcements from Milan, from London, from Paris, that there will be a lot more bike lanes, there will be encouragement of active commuting, physically active commuting by walking and cycling, and not just a reversion to the automobile. I haven't heard so much about that in Boston or other American cities, unfortunately, but here's hoping. Well, we've got two great people to talk about this topic. Lucy Hutyra is a professor here at Boston University, a prominent member of the faculty of the Initiative on Cities, and her topic is her research has focused on the cycle particularity role of vegetation and land use changes to to carbon and the relationship between the biosphere and the atmosphere. So she has done a great deal of work on monitoring pollution and discussing ways in which vegetation, particularly trees, can counteract the problems that we create in pollution in our cities. So thank you, Lucy, for being part of this seminar today. We're also joined by David Miller, another friend of the Initiative on Cities, a member of our external advisory board. David is a former mayor of Toronto and is currently director of international diplomacy for the C40. The C40, as you may or may not know, is a lot more than 40 cities that are actively seeking solutions to the climate problems that confront the world. Currently has 94 members, dynamic cities facing up to environmental problems that all too often national governments, including our own, are sadly neglecting. David has a book coming out in October on this topic. The book is called How the World's Great Cities are Fixing the Climate Crisis. Sorry for my stumble on that title, but it's going to be a really exciting book drawing on his experience at C40 and before as mayor of Toronto. So David, welcome. Before we get going on the seminar, I'm going to bring in my colleague, David Gross, who's just going to go over some of the procedural and housekeeping aspects of the seminar. David.
Welcome, everyone. Thanks for joining us. Just as a heads up, this session is being recorded and is also being simulcast on Facebook Live. Recordings will be available via Zoom for a limited period of time after the webinar, and will also be available indefinitely on YouTube around the end of the week. After our two panelists, we'll open up the webinar to questions from the audience. At any point throughout the webinar, please feel free to use the Q&A feature, which is at the bottom of your Zoom window, to submit a question. If you see a question asked by someone else that you'd like answered, please feel free to upvote that instead of asking a duplicate question. And with that, I'll hand it over to Lucy to begin. Lucy.
I think you need to stop sharing for me to be able to share. Great. Let me just pull my slides up. Excellent. Well, thank you so much for the invitation. It's an honor to share this virtual stage with David Miller, and I look forward to hearing some of his thoughts about what he's seeing around the world and more on the policy perspective. What I'm going to focus my discussion on is a bit more on the pollution and the science, and in particular about the air. So we've seen a lot of headlines, and I'll just throw up a few from the recent news. This was one of the early ones from NPR showing some of the changes in the tropospheric nitrogen dioxide. And you see these stark differences in the satellite-based measurements of these gases. This is an article that came out in the Boston Globe a few weeks ago about air pollution declines here in Boston. There have been large changes around the world. This headline is one from the BBC about what's happening in India and the prospects of a clean air movement launching there in response to these massive changes. And there's also questions about how the coronavirus crisis will interact with the climate crisis, because many of these, from the health perspective, there's linkages, the emissions that are changing, and how it will, what the economy will look like in the future, and where the investments, particularly the recovery investments, will go. So I want to dig a bit into this air quality and some of what we're seeing and we're not seeing, not so much from the policy end, but from the science end. So let me start by trying to demystify a bit of the alphabet soup. Scientists have a tendency to use acronyms, and when it comes to air quality, there are many compounds and a lot of acronyms that you'll see. What most of the images that we've seen displayed about air pollution improvements have focused on NO2. NO2 is nitrogen dioxide. It's a short-lived pollutant that's reactive, and it's associated with direct combustion, so electricity generation, our tailpipes. And these concentrations have gone down. This is a paper that came out in press yesterday from colleagues in Europe. This is from the Geophysical Research Letters. And this is showing how China's NO2 concentrations from the Tropomi satellite have changed. And so this is up through just a couple of weeks ago. And you see high concentrations, the New Year lockdown, as denoted by the little padlocks here, a decline. There's a bit of a spike here in late January, and it goes way down, and then it starts to turn back up as the economy reopens. And it's images that are analogous to this that have dominated the media about the environmental improvements, and they're real. We've seen declines in NO2, most of them measured from this Tropomi satellite, that suggest changes on the order of 43% declines in Wuhan, 38% in Milan. Washington, D.C., the numbers are coming in at about 21%. But other places haven't seen changes. Iran, which had a heavy COVID impact, has had no measurable change in NO2. And when we think about how these gases are changing and the air quality is changing, it's important to note that COVID is not happening in isolation, where these concentrations would have gone down anyway because of the seasonal cycle that we're in. So we really need to be a bit cautious in over-attributing some of these changes to COVID, where the lockdowns are real and the economic changes are real, but we'd be seeing declines in some of this irrespective, just because of sun angles and clouds. So when we look at this data, caution has to be taken in some of the before and after attribution to make sure that we're attributing it to the right mechanisms. That said, these estimates that I'm showing here are year-over-year changes, so comparing 2020 to 2019 and previous years. So we're seeing large changes in the NO2, and that's short-lived. NO2 lives in the atmosphere for just a couple of hours, so it's really a local change in air quality that you're seeing there. Particulate matter is the other compound that we've seen big changes in. That's PM 2.5, which is 2.5 microns in size. And we've seen large changes, and this is an example from India. And this has big impacts on visibility, on air quality, and on human health. The changes in PM have been smaller than what we've seen for NO2, but they're large. But PM comes with an important caveat. Some of the changes in PM might lead to short-term climate warming, because particulate matter actually reduces some of how much radiation and sunlight reaches the surface. Some of it is reflected back in space. So while this is a great thing for health and air quality to be reducing the PM, there are some additional impacts as it moves through the system and the climate system in particular. The other wrinkle in some of what we're seeing in air quality comes with ozone. So both ozone and nitrogen dioxide are reactive. And as the concentrations of NO2 have gone down, surface ozone concentrations have been observed to go up, because with less NO2, we're getting more ozone because the reactive chemistry has changed. This is not true for all cities. It depends on the details of what the air soup looks like in a given city. But a number of cities are reporting increases in ozone concentrations that are a factor of 1 or 2. And that's really important because ozone is a primary pollutant. It's regulated by the US EPA and by many other counterpart agencies, and it causes pulmonary and heart disease. So air quality has been improving, but that's a very general statement. We want to look at what exactly in the air is improving, and how it cascades through the rest of the reactions and components in the air. And different cities are seeing different sorts of changes. And that's not at all surprising, because different cities have different economies and emissions profiles. Some cities have power plants located within them, and other cities don't. Some cities are denser, some have massive mass transit, others don't and rely more on the on the automobile. So the COVID effects are going to vary pretty dramatically from city to city. The image that I have up here now is one that one of my former students and I put together from a few years ago. And this is looking at emissions in cities across 16 Northeast US states. And I'll point out just 2 examples as contrasts. Rhode Island has a power plant within the city limits of Rhode Island. The emissions profile of Rhode Island will not have changed as much as the emissions profile of, say, Massachusetts. Where Massachusetts, the local emissions in the Boston area are dominated not by power plants, because we don't have as many large power plants as Rhode Island does or New York City does, for example. So the changes that you'll observe in Boston will be different than the ones you'd observe in Providence, because the emission sources are different between these cities. And this is true around the world. In China, there's a heavy reliance on coal for heating and for energy. And so that will have a different signature in what the air effects will be. In Paris, in France, there's a lot of nuclear power. And so the proportion of emissions that's coming from the other sources will be much higher, because they're not emitting CO2 for power generation. So if the power generation emissions are lower, then the relative impacts locally of turning off transportation emissions will be higher. And geography and meteorology also play a large role in this. This is a picture of Salt Lake City in Utah. And Salt Lake City is a city that has air quality challenges that have more to do with its meteorology and its geography than its actual emissions. And in some cities, the physical environment is such that even if emissions are changing, the air quality may not change in the same ways as it would in other cities. So not all cities are going to be observing the same sorts of changes in air quality. The other piece of what we're seeing in the air is some of what's coming. This is an op-ed that was published a couple of days ago by former EPA Administrator Gina McCarthy and Michael Bloomberg, former mayor of New York. And there's a lot of concern right now about what the longer term and the near term impacts on air are going to be, as the lockdown has reduced local combustion and local emissions. But there are policies that are coming into place to relax some environmental regulations to help manufacturing and industry make up for lost production. And some of the rules that are being relaxed are particularly related to air quality. And how exactly that's implemented could have impacts on what the long-term consequences of this looks like. So I wanted to start with a bit of a primer on the what we're seeing in the air in some of these compounds like NO2 and particulate matter and ozone. But now I want to turn to CO2, which is actually what most of my personal research focuses on. So this is a picture of me on the roof at Boston University. So this is an air inlet sensor. This is Boston right behind me. This is the view if the camera had turned just a little bit. And for 8 years now, we've been measuring CO2 concentrations on the roof here. And so this is the 2020 concentration data. So January through last Friday. And this is what the CO2 signal looks like here in Boston. Schools closed in March 13th. The lockdown in Massachusetts came a few days later, so I've just color-coded that data. And the difference that we see in CO2 is small. Before and after, we're seeing a difference of about 12 parts per million, which sounds like a lot, but these are urban measurements, and we have some very large spikes. Those are related to weather events. Those are, there's a lot of local emissions that happen right in the city. And the difference that we're seeing here is not a COVID difference. The difference that we're seeing here is a seasonal difference, which I'll come to in a moment. But the differences that we're seeing with these massive changes in the economy are not very clearly visible in the urban atmosphere in the case of CO2. And it's not because Boston is somehow different from the other cities. This is some traffic data that I scraped from the Massachusetts Department of Transportation. This goes through May 10th, a couple of days ago. Here's school closures, here's the state lockdown. You can see that traffic volumes have declined 50, 60%, in some portions of the city, 70%. So the traffic has gone down, our activity has changed. We see and it's starting to kick back up, I'll point out. It declined very rapidly. We're still in lockdown until potentially May 18th, but even as lockdown has gone on, our traffic volumes have started to increase back up. And my colleague Jeff Geddes, he's been measuring NO2. These are data from the Kenmore station right by Boston University. This is the lockdown weeks in April of 2020 compared to a normal year. So we have similar changes in air quality in compounds like the NO2, but we don't see it in the CO2. Here I've zoomed in on the CO2 data. This is April and May. Again, up through last Friday, I think this data is plotted 2019, 2020, so year over year changes, and there is no difference. And there's no difference that we can detect because there's a lot of things in play in the atmosphere in cities when it comes to CO2. And the timing of COVID has made it particularly difficult to detect this compound. So this is what Boston's typical emissions profile looks like in the wintertime and in the summertime. Boston's cold. We still are using our heating now. In fact, it was on this morning. And in the wintertime, residential emissions are fairly large and commercial emissions are larger because there's a lot of heating that takes place and that results in CO2 release into the atmosphere. As we move into summer, we turn off our heating systems finally, and the role of transportation in driving the local concentrations of gases increases. The relative contribution of transportation and point sources changes. So we're at the seasonal transition in what emissions look like in the city because it's warmer, but not quite warm enough to turn off the heat. The other piece that's in play for CO2 is the leaves have come out on the trees. So the timing of when all of this is happening, and this is coming off of a particularly warm winter where soils didn't freeze, is that biology in the early part of this season was releasing carbon dioxide because the soils were not frozen. As the leaves have come out, biology has started to take up CO2 out of the atmosphere. We're changing what our heating profile looks like at precisely this time, and we've reduced our traffic emissions. These are a lot of changes that are happening all at once that it's difficult to disentangle for CO2. I want to zoom out a little bit, but as my last thought here about CO2. So this is what we're seeing as of last Friday in Boston for CO2, but I want to look globally. So this is a graphic that I got from the BBC. This is data that's coming from the IEA and the Global Carbon Project. So this is showing what global CO2 emissions look like between 1900 and the present. You could see the dips and declines associated with major world events, pandemic, depression, wars, the most recent financial crisis. Before COVID, we were on track to have CO2 outputs in 2020 increase by about 1% based on GDP numbers. The current estimate puts us here. This is a forecast. This is a highly uncertain forecast for what global CO2 emissions will look like. This is the largest decline in CO2 emissions that we've observed in modern history. And the next couple of figures that I'm going to show are from this Carbon Brief report, which came out about a month ago, and it's the most comprehensive data piece that I've seen come together. It was a small update to some of the numbers in here that I'll point to in a moment. So the source for the next slide is this Carbon Brief report. And this report puts in context the changes that we're seeing with COVID with respect to other world events and the estimated impacts on oil in different countries. Like I said, currently, the estimates are suggesting that the year-over-year decline in global CO2 emissions will be 6 to 8%. But a lot of that, this is May, and a lot of what the 2020 changes will be depends on what we do next. And this is good. We need to reduce CO2 emissions. This is not a good way to do it, but they're going down. But I want to put these numbers in context. We're not on track to be anywhere near keeping global temperatures within 1.5 degree warming. The global emissions would need to go down 7.6% every year for the next decade to get us to 1.5 degrees. So a global pandemic and a massive economic shutdown has gotten us there. This isn't the way we want to get there, but there might be things we can learn from what has happened to be able to sustain some of these reductions. So final thought before I pass it over to David. This is a picture that is not a recent picture, I'll point out. This is Park Street. This is the subway, the central subway station in downtown Boston. This is a train bound for Boston University, and it is crowded. Boston has the distinction for 2 years running of having the worst traffic in the United States. Our trains are full and our roads are full. And there's major shifts coming in how we move and how we work. And I don't know how those are going to play out, but there's big choices that we as cities and as individuals have before us about what the role of this sort of remote work looks like and how we're going to move, whether it's by bicycle or these 15-minute city models. And I don't have a crystal ball, and I am done with the easy part of this talk, and I'll pass it over to David, who will pick it up from here for the really hard part of where do we go from here as far as policies.
Thank you for that wonderfully clear presentation, Lizzie. David.
Thanks very much, Graham, and thanks, Lucy. That was a fantastic presentation. I must say your last couple of slides made me want to sing the Charlie song, "Will he ever return, will he ever return? His fate is still unknown. Will he ride forever beneath the streets of Boston? He's the man who'll never return." But you have posed a very sobering question for our mayors, and just about public transport, and I'll speak to that in the context of my presentation. But first of all, I want to thank Graham and the Initiative on Cities for the welcome and for the excellent work at a time like today, where we see very significant challenges being faced by cities and mayors, the work of the initiative on cities is really critical. And the academic work, for example, yours, Lucy, that supports the opportunity for mayors to make science-based decisions is also really critical. So I want to thank Graham for his leadership, the Initiative on Cities for their work, and I appreciate the opportunity to speak today. Just a couple of background things before we go to the next slide, David, about C40. As Graham indicated, we're a coalition of mayors of 94 of the world's largest cities. It was formed in 2005 by then Mayor Ken Livingston, and there's basically three founding principles. The first is that the actions of the mayors of the world's largest cities can make a material difference to success on climate change. The second is that the voices of the mayors of the world's largest cities, cities like London, New York, Paris, Jakarta, Cape Town, and of course, Toronto, Canada, where I am, the voices of those mayors can make a significant difference on the international stage. And the third is that our organization is half from the global north, half from the global south. That's been a founding principle, and it's been true since. So if a new member wants to join in North America, they're unable to unless we have a new member, for example, in Africa. And it's a really important principle because the mayors find that they learn as much from the global south as we in North America might assume that they're going to learn from us. It's often the other way around. And I think a very important point at this moment when we share challenges, global health challenges through the pandemic. So my presentation is going to speak to some of the challenges mayors are facing with respect to air quality. I am not an academic. My background is economics and law. I'm a lawyer and a former elected official. And I come to air quality through the lens of a practitioner who is helping cities make the right decision about climate change. So that's the context for our work. We do have an air quality team. I'll speak to that a little bit. And the information I'm giving you is based on their excellent work. Next slide, please. So as Lucy said, there's a number of important emerging facts about air quality and COVID. And it's really of very significant importance to our cities in a variety of ways, particularly the research that suggests, and it's emerging research, certainly not rigorous peer-reviewed science yet, but it's fairly clear that air pollution may well worsen the coronavirus pandemic's effects. And that shouldn't really be a surprise because we know in the most polluted cities that there are very significant health effects of air pollution. We know, for example, in London, England, Mayor Sadiq Khan brought in an ultra-low emission zone about a year and a half ago, and specifically argued that the reason to address emissions from traffic was the very high rates of asthma of school children in busy built-up areas in London. I happened to be there when it was announced, and the BBC that night interviewed a school that had a rack of asthma puffers on the wall. That's how significant the health issues were in those children, and the data showed quite significant drops in pollutants, airborne pollutants, after the ultra-low emission zone was brought in. So the relationship between air quality and COVID and air quality and health is an ongoing concern for mayors, and very often for organized groups of citizens. And sadly, I think if you look at most global cities, you'll see that the worst impacts on health from air tend to be in low-income neighborhoods or other neighborhoods that are marginalized from the political process, including neighborhoods in which a significant number of newcomers to a country live. So there's a direct link between air quality, health, and equity. And of course, from our perspective as a climate change organization of mayors, a link between doing the right thing for climate and producing better health and equity outcomes. Next slide, please. So I think these facts are very consistent with Lucy and her presentation, the professor. Those with pre-existing health conditions or increased risks of severe health outcomes or deaths from COVID. Exposure to air pollution damages the hearts and lungs. Therefore, people living in areas with high air pollution are at real risk from COVID. And prior research into similar viral infections have shown relationships between air pollution exposure and increased risk of death through infections. That's fairly certain. Then there's some preliminary studies that seem to show a link between this particular virus and air pollution. For example, there's a correlation between the rate of death in Italy and pollution levels. But as I indicated in the last slide, that's not peer-reviewed science yet. It's likely that that correlation is causation, but that's not proven at this point. From a mayor's perspective, you sometimes need to act on incomplete evidence and the best evidence you can get. And that kind of correlation, given the other evidence historically about a connection between health and air quality, would lead mayors to act. And in our context at the C40, the other thing I should have mentioned about the organization, we have 16 networks globally that work on topical issues. And the way to think of them is as a best practice sharing network. So they're a forum for mayors and city staff to collaborate around an issue, and air quality, of course, has been an ongoing collaboration for our members, extremely important one for the members for obvious reasons. Next slide. Next slide, please, David. So we just saw air pollution's declined in many areas with shutdowns, same information that we just heard, large decreases in NO2, but mixed results in particulates. Ozone increases in some area, more work to be done. Interesting results. Next slide, please. So our air quality network at the moment is working with our cities. Historically, it's done work on evaluation of air pollution trends and analytic methods for assessing changes, with a particular emphasis on what local sources are contributing to these problems, whether it's traffic or power plants or other issues, because those sources tend to be also sources of CO2. And therefore, if you can address them from a policy perspective as a city, you can address carbon emissions as well. And one of the things our mayors find is in many places, you can speak to people about air quality and local health issues. In fact, people will also speak to you about air quality and local health issues in a way that you sometimes can't about climate, because air quality is very immediate and short term and now. And climate, of course, is extremely serious, real. The vast majority of people in the world want action, but it doesn't quite have the immediacy or visibility that air quality issues often do. Next slide, please. So by way of background, starting in mid-March, our mayors who, C40 is a voluntary collaborative of mayors, there's no membership dues. To be a member, you have to be, generally speaking, a city with a population over 3 million or be doing something very special on climate. And you have to have committed to have a greenhouse gas reduction plan that will peak emissions by this year, have, generally speaking, have them by 2030 and get to net zero by 2050. The reason for those targets is quite specific. The reason is because we've analyzed what our members, and our members represent the urban regions that surround the cities, represent approximately 750 million people. So it's like an extremely large country. Our members' share of the carbon budget has been analyzed, and if you go back to how to get on a 1.5 degree trajectory, that's our share. Collectively, our cities have to halve emissions by 2030 and peak them by the end of this year. In places like Africa, the peaking's a little bit later. Last year at our summit in Copenhagen, which the Institute of Cities was at, and thank you very much for participating, we announced that 34 of our cities have already peaked emissions. Really important statistic, particularly when compared to what national governments are doing. I think reinforces the need for city-led action on climate. That's the purpose of our organization. But starting about 8 weeks ago, our mayors, who have very few places where they can collaborate as mayors, city staff have quite a few places where they can collaborate as mayors. We're really the only organization globally that is mayor to mayor. There are very important and excellent city-based organizations, but globally, mayors were thirsty to collaborate with each other about COVID. So we have created response teams internally. We of course have an internal one for our own response as an organization. But secondly, we have a team to help cities in their response to COVID, and we have a team to help cities in the recovery from COVID, based on the same kind of model of peer-to-peer learning that I was speaking about previously in the context of air quality. So our air quality network has stepped up to help mayors and coordinate peer-to-peer responses. And so this is what they're doing. They have a WhatsApp group. People are in touch all the time. There's weekly what they call office hours, when there's an informal conversation with city staff. There's facilitated calls, regional calls. We have a knowledge hub on our website that puts the best information we have to assist our cities in their response and recovery to COVID. And then we have frequently asked questions. A particular one is, how can we use air quality data and engagement and recovery to make a stronger case for retaining and implementing new pollution reduction measures? Really what that's saying is, our mayors are hearing from people, they actually like clean air. It smells different. It's good. People recognize it. They like hearing the birds. On my street in Toronto, we have a coyote that comes twice a day now. At about 7:30 in the morning, I'm told, and around 11 at night. There's deer nearby. You know, I live in the middle of a busy city. These are things people value. They value the health impact, and how can we help our mayors talk about that in the context and keep that and produce policies to keep that kind of condition post-COVID. Next slide, please. So here are some things that have happened with our assistance and with peer-to-peer, with the assistance of each other. So Mexico City and Barcelona are collaborating on how do you communicate to people about the fact that some air quality indicators are going the wrong way, and what data do you need to help people understand where the air challenges and what needs to be done. London, Paris, Madrid, and Milan are discussing very much these ultra-low emission zones. A couple of them have suspended them. How do you bring them back, and when, and how do you persuade people that's really important? Paris is creating 650 kilometers of cycle routes. It's incredible. And this is one of the things we've really seen the cities do, is repurpose roads from cars to active transportation for all sorts of reasons, but one of which, of course, is air quality. And Paris is helping our other cities learn from this approach, loosely called a 15-minute neighborhood approach. The idea being, how do you facilitate people living in their neighborhoods and getting around them in an active way instead of having to drive? London and Mexico City are sharing with peers their research findings on COVID-19 impact on air pollution in their cities. And then Milan's going to share its plans on reallocating space to walking and cycling. Recently, we had a mayor's call. We have mayor's calls about every 2 weeks now on COVID, and some of these issues were discussed. And one city, within an hour after the call, announced that it was going to be repurposing roads, road space for pedestrians and cyclists. And until that call, the mayor had been quite resistant to this publicly, but hearing from his peers how successful it was and how people were very thirsty to live in a place that had good air quality and good transportation quality, changed his mind. It was kind of an interesting impact. Next slide, please. And I think I'll make this slide the last. I'm going to comment on this and then add one more comment about public transport. So some other things that are happening. Vancouver's issued a ban on open burning. Several other places, regional and local governments have issued guidance and raised awareness on health impacts of open burning to protect people's health during COVID. A whole range of cities, as I just said, have been expanding walking and cycling. London has been very proactive in getting the facts out so that people understand that ultra low emission zones, which is the name for areas of the city that you have to pay a very, very high toll to travel in a polluting vehicle, that those ultra low emission zones are highly effective. Final point I want to make is about public transport, because the cities that are members of C40, large built up cities, including Boston, don't function without an excellent public transport system. And public transport is under a significant challenge right now, because how do you make it safe for people in a physical distancing world? And it's a bit of an existential challenge. But our cities are discussing this very actively as we speak. I have some personal thoughts. These are not on behalf of C40, but based on my knowledge of over 20 years in municipal politics in Toronto and multiple years working in academia for not-for-profits and at C40 on these issues. My perspective, first of all, we need to demonstrate to the people who work in public transport that it's safe for them. And it's a bit of a forgotten group, but over 100 people have died, I believe in the figures for North America, operating public transport. And it's probably because they're getting significant exposure all day long to COVID in their workplace, but they have to be safe. Secondly, riders have to be safe. So cleaning and so forth is critical. We need the best guidance from the best science about the impact of COVID in enclosed spaces and how to deal with it. And thirdly, we need to dramatically increase service. It's the only way to address the congestion that was shown at PAC in the slides earlier, because without dramatically increased service, people are going to be shoulder to shoulder with the concomitant health risks. With dramatically increased service, there is a possibility in things like flex hours and a slow return to work for people who can work from home, that these cities can function. And if you ally that support for public transport with significant increases in the ability for people to get around through active transport, cycling and walking, and repurposing roads for that, you have a chance of allowing these cities to function. If the policy decisions are taken from state and national governments that don't provide enough funding to support that dramatic increase in public transport, you will see a return to the automobile, and the cities can't function from an economic perspective, a traffic perspective, or an air quality and health perspective, let alone a carbon perspective. So from my personal view, that's a really important outcome to come out of discussions over the ensuing months about stimulus, about financing cities, and about how we build our future cities in a way that's truly resilient. That's probably a little more than I was meant to say, but Graham, those are my thoughts and comments, and back to you. David, I don't need to go to the last slide, David, it's okay. Oh, and there's my book, Solved. There we are.
Thank you, David. Great thoughts to share with us. Thank you very much for doing so. Lucy, I was just sort of rocked back by the sort of concluding section of your talk, which I don't know if this is a simplistic way of putting it, but it seemed that more or less shutting down our economies in general had produced the sorts of savings that we need to achieve in the long term. Is that a reasonable interpretation of what you said? And does that make you sort of feel pessimistic about the future, or do you think that what we can see now is how to do it?
Oh, Graham, I thought we were saving all the hard questions for David. You could be pessimistic that we've turned our entire lives and economy on its head, and we've ended up with a 5, 6, 7% reduction in emissions, and say, oh my God, we've done all this and we only reduced emissions that much, which is one way of looking at it. But the other is that we haven't structurally changed where our power is coming from. The main change that we've seen is that transportation has changed because people aren't moving around. And in some industrial, and depending on which country, some industrial activities have declined. In China, in the United States, I think in Massachusetts, it's something like 40% of people are considered essential and are still going to work. So those traffic numbers haven't gone to zero, and we're still heating our homes, we're still using power. We haven't fundamentally changed our power system. And so I think that this highlights the challenge that we have before us. It's a daunting challenge. It was a daunting challenge before COVID, but what I think COVID has shown us, or at least has shown me, is I didn't work remote very much before COVID, and I traveled a lot. I haven't left the house much in 7 weeks, and it turns out that video conferencing works pretty well. And I think a lot of people have seen some of these changes, and that flex work model that David was talking about, I think, at least for me, feels more possible than it did before having this change imposed upon us all. So I think that there will be some lifestyle changes and work style changes that are to come. But fundamentally, we need to change our reliance on fossil fuels and where our power comes from.
There had been a question, it's disappeared from my screen, but my colleague and co-director, Catherine Lusk, was going to ask you, David, have you seen cities in general stepping up to move forward on the pollution front, or have you seen with the challenges of unemployment and economic hardship backsliding?
Yes. For the very large part, Graham, we have seen cities step up. And it's been very interesting to see, because what Milan, Paris, and Vancouver, for example, have done around walking and cycling is make permanent, or at least as permanent as you can make a changes that are needed now to accommodate people moving around in their cities. So they're transforming some of the world's busiest cities from cities that were perhaps more reliant on automobiles than they needed to be, to ones that are now going to have a very powerful structure of walking and cycling that will be there permanently. They're doing it in a permanent way. So that's very powerful and positive. The considerations of ultra-low emission zones are very powerful and positive. And one thing I didn't get to talk about, and if it's okay to give a bit of a longer answer, I didn't speak to it because it wasn't relevant to specifically to air quality, but it's quite relevant to this question and to the question you asked, Lucy. We have a mayor's task force. It has some superb principles. I encourage people to look on our website and look for the principles. They're superb. On post-COVID recovery. And the idea of the task force is to produce a report in September. There'll be an interim one in June about what cities can do themselves and what they need to ask of national governments to ensure that the recovery is equitable, healthy, which includes air quality, and low carbon. And if you think about it in that context, it is possible to take what Lucy just said and think about how do we invest now in a way that's going to bring jobs back, but that creates cities that are increasingly low carbon. So yes, of course, some of it's around transportation, public transport, active transport, thinking about neighborhoods more and how can people live in those neighborhoods, particularly if they're going to work at home more, that kind of thing. But it's also about electricity and how can cities help lead a much faster change away from fossil fuels where they're still used, and they're still used quite extensively in the United States of America, for example. It's also about buildings and the energy consumption to heat and cool buildings. And, you know, with a lot of buildings much less used right now, now is the perfect time to retrofit them. And it's a massive job creator to do that. And it's also about how we handle our waste, including waste from food. And then it's about some personal things like, you know, air transportation and how we eat and so forth. So the mayors are actively thinking about how do we help rebuild in a way that's low carbon. So it wouldn't exactly maintain the trajectory we're on. It would actually improve on it, knowing that as we're able to get back to work, some things are going to get worse. So we've got to make other things much better if we're going to stay on a 1.5 degree trajectory. And for us and for what mayors can do, it's around those things: transport, buildings, energy, and waste. And yeah. So that's my answer to the question.
We have another question from Eben, and Eben was going to direct this question to you, David, but I think I'm going to start by asking Lucy to comment and then come back to you. And the question is, do cities currently have the quality data at sufficient temporal and spatial resolution to tell the stories they need to tell to engage and educate the public, especially communities most impacted by environmental health disparities? Lucy, do you want to take a stab at that and then we'll come back to David?
No, they don't. We don't have adequate data. Most of the images that we've seen in the newspaper, like those NO2 images, those are coming from satellites, relatively recently launched satellites that give us a granularity that starts to be able to see some of the differences across cities and even within cities. But if we think about the surface monitoring network, the networks that we have in place that are measuring, you know, at the ground level where the highest densities of people are moving and walking, most cities don't. I think New York City and some of the C40 efforts to deploy really dense observing networks are amazing, to be able to see the differences in different communities, in environmental justice communities, and some of these more vulnerable communities. But most cities, no. There's been a proliferation of these low-cost sensors that, you know, for $50, $49.95, I could buy one of these, put it out my window. And there's information in that, but that's not the same as having calibrated and coordinated measurements that are in place across the city. So my answer is, I think that there are a handful of cities that have incredibly rich data sets. The C40 has helped contribute to that, but most cities do not.
David,
Lucy's correct. I'd just add London and Bangalore are leading some of our C40 work on this to use low-cost sensors and have a complete network of it. And I think, Lucy, I hope I'm not wrong in saying this, you'll know better than me, that that's one of the reasons that London had such good data on which to base its ultra-low emission zone to keep polluting vehicles out of the core, because it has done that work in preparation. And those are things a lot of cities need, but probably only the leading ones have. I think Lucy's spot on there.
If I could just add one thing, I was a little bit disparaging of low-cost sensors. There's a place and a value for low-cost sensors, but they still need to be carefully deployed and calibrated. And you need to know there's details that are really key in being able to appropriately interpret that data, but we don't have enough.
I'm going to invite both of you to sort of make concluding comments, but I'm going to try and sort of provoke you in the direction which to go by saying that the lesson I'm taking away today is that we live at a particularly critical moment, and all moments are critical in relation to pollution and the climate, I know, but you can see things possibly going in good directions or possibly in very bad directions. That I read about the Conservative British government saying that it's allocating over £2 million to promoting active commuting on foot or by bike, and I'm cheered. On the other hand, I do worry intensely about the future of public transportation, and I have this nightmare vision of people, even more people in Boston, deciding that the safe way to go to work is to get in their car and make our appalling traffic even worse. And I'm really not hearing very much, if anything, from either the mayor or the governor that makes me think that there'll be action to go against that. So where I think I'm heading is that if this is a particularly critical moment, is there anything that our audience as citizens as well as scholars could be saying or doing to try to make sure that we go in a good direction?
David, you want to start out?
Sure. I think it's a fantastic question, Graham. And I'm often asked when I speak in question sessions, what can we do? And I think people expect answers about climate change, like become vegetarian, don't fly, those kinds of things, ride your bike. But there's a much more powerful thing that people can do, particularly the academic community, but not just, which is use your voice. And it's really important at this moment. It is abundantly clear that if we make the right decisions now, particularly if the investments that the national government, the US and states are going to have to make in order to make sure people are working, if those investments in it are made in a way that thinks consciously about a low polluting, low carbon, high air quality, equitable future, this is a moment that can be transformative. But that will only happen politically if there is excellent science on which to base it that is clear and is communicated simply and clearly the way Lucy did in her brilliant presentation. Clear, absolutely clear. And it will only happen if people speak up and say, this is the future we want. We don't want to sit in traffic. We don't want coal-fired plants. We know that there are storage methods that can link up wind and solar, depending where you are in the country, to ensure that we have a safe supply of power. We want to live in really good buildings that are high performing. And we want to have clean air that smells sweet, not dirty. And we want to hear the birds sing. And if people can speak up really powerfully about this, and if scientists can right now, quickly, in real time, show why it matters, I believe we have a real chance to win this moment and build that future. And the core of it is equity, because it's so clear that COVID has hurt those who are powerless, low-income people, newcomers, racialized communities, far more than others. There's no question about it. And if we collectively talk about a future that is going to be equitable and has all those benefits, it's a powerful vision, and our voices together can help ensure that politicians who want to lead will be able to and can put in place the policies to make it happen. That would be my advice, but it relies on people speaking up and on excellent science.
Lucy, you've produced excellent science and you communicate it beautifully. You've got the last word.
I have nothing to add from what David said, except on the science part, my community, I have never seen so many people mobilize so quickly to analyze and process data at near real time to understand what we're seeing and interpret it correctly. And that last part is I think really key. We're seeing big changes, but we need to understand why we're seeing them and some of the cascading effects like the ozone changes that are associated with some of the NO2 concentration changes, and to be able to make policy decisions where we think about not just one compound or one pathway, but think about the suite of things that are changing.
Well, I'm going to end by thanking you both so much for giving us your time and your expertise. A reminder that David's book, Solved: How the World's Great Cities Are Fixing the Climate Crisis, is coming out in October. The publisher, David, is?
University of Toronto Press.
University of Toronto Press. Thank you both for a great session and a truly inspiring one.
Thanks so much, Graham.